Eye diseases as you get older cause symptoms that gradually sneak up on you. So take, for example, cataracts. It's completely natural. When someone hears they have cataracts, sometimes they're concerned, but it's completely natural. People say that it runs in their family. That's because everybody gets them, so it runs in your family. And so it sneaks up on you gradually. You begin to develop cloudier vision, glare around headlights, streaks coming out of headlights and road signs, trouble reading, trouble doing your job, trouble seeing a computer, you name it, anything visual sneaks up on people gradually. And eventually they come to the point where they realize that something isn't right. They need to get evaluated to see what's wrong. Sometimes it's simple, sometimes it's just a change in the glasses, sometimes it's cataracts, sometimes you can deal with that with a change in the glasses, but sometimes you cannot. So extremely common for cataracts to develop, and they can be pretty significant looking, but cause minimal symptoms. They can always also have very mild cataracts that cause a lot of symptoms. So there's really no correlation between your age and how fast the cataracts is developing. The symptoms sometimes come sooner for some people and sometimes later for others. And there's no way to predict by looking at someone when they're going to need surgery, or a better way of putting it, when the patient will say they want surgery to help them see better. It could be months or years or never. Well, it is surgery to correct cataracts. There's no medical treatment for cataracts. You can't wear special glasses. There's no pills, no drops to prevent cataract formation. So you have this choice between having surgery and not having surgery. It's a general phenomenon in medicine. You've always got a choice between two not so great things. You can choose to do nothing and put up with the symptoms you have, or you can choose to have surgery. So if you decide to have surgery, you have to be aware that there are risks because it is surgery. So anytime you do eye surgery, there's always a risk of things like infection and bleeding and a long list of other things. So if that risk is acceptable, you have the surgery and you come to the surgical center. You're given sedation, anesthesia, so there's no pain whatsoever. Surgery itself takes 10-15 minutes, and you're here for about 2 hours usually. And it involves removing the cloudy lens of the eye, which sits right behind the pupil. And it's removed, and you place a lens in it to take its place, an artificial clear lens, usually a foldable plastic lens that's inserted behind the pupil. And then the incisions are usually self-sealing. Once in a great while, we have to put a suture in that are painlessly removed a week or two later. And you go home. And for me, for my patients, I don't place any restrictions on patients except for no swimming and opening your eyes underwater for 1 week.